I hear a lot of stories about visitation and conflicts around visiting hours. That's a very common complaint. I heard about a young child who was raised by their grandparents, and the grandfather ended up in the ICU. And because of our visitation policy, they were not able to be together when he passed away, and it really hit home. And it was at that moment that we kind of decided no more, that we could do better.
Hello, Mr. Zarate.
The whole premise was that people were coming to visit our facility. And so we just turned that upside down. And we said, no one is coming to visit our facility. There's no such thing as a visitor. Actually, these are people's lives. And the people who come to be with them are part of their life. And we're the visitors, not them. And so we transformed the visitor policy into a welcoming policy. So what we said is, visitor no more. At Contra Costa Regional Medical Center, we will welcome people 24 hours a day, 7 days a week. What we did to implement it is it began by bringing everyone together, all of the key stakeholders. That would be patients, loved ones, different community groups. Our security played a huge role in it, clinical staff of all kinds, and other support staff. And so we brought those people together and said, if we were to go to an unlocked, welcoming environment all the time, 24/7, let's identify all the things that are preventing us from doing that, and then sort of start to problem solve one by one.
So one of the things that I think really worked well was when we had the walkie-talkies on the unit for the nursing staff.
It's important to acknowledge all the anxiety people have around these changes, because there are real reasons for it, but there are also real ways to overcome it. And I think bringing people together is a key activity that you need to do, and you can't sort of have all the clinical people design and then bring security in later. I think that that's a mistake. I think bringing them in right away, because they need to learn too. We learned as we go, and I think that's the important thing, is to create an environment of continuous learning. You may not get this right the first time, but you sort of get back up and you make an adjustment, you make an adaptation, and you go again. As long as you're learning in the right direction and you have safety in mind and you're keeping everything safe, I think that that's okay. I have a lot of fun tracking the numbers on the welcoming policy. In the first 3 days, we had 43 people stay, either some of or all of the night. After 3 weeks, we had 341 people, and in 40 days, we had 641 people stay overnight. And one of the things that I do though, is I publish those data, because I think it's important for the staff to know what's happening. It's a huge change that we've asked them to undertake. And so making sure that they know, what the results are of that change, because they may not know, maybe only 4 people on this one unit, have stayed over. So I think it's important that they understand 640, we've been successful 641 times. In just over a month, that's a big deal in a 166 bed hospital. That's a very big deal. So, there was clearly a demand for this. There was clearly a need. I feel pleased that we've taken this step, but there's much more ahead.